So, we are going to change topics slightly and go into effective treatment. So, as we were discussing with the history of ABA, um, a lot of previous focus of ABA was on experimentation. Contemporary ABA really focuses on experimentation but implementation as well. So, prior to talking about some of our procedures for implementation with ABA, we'll cover effective treatment and what that looks like. So, the first area here is that everyone has the right to a therapeutic environment, meaning their environment should meet all of their individual needs and they should be healthy, safe, and enjoyable. So, basically, they need to be able to access their basic needs. The second area here is that everyone has the right to services to make gains in their own personal welfare. So, primary goals should relate to increasing functional skills that lead to increase in quality of life. So, this really goes back to our focus on socially significant skills. So, we really need to be aware of what skills are socially significant for that individual. Um, so, an example of that would be teaching um, an adult who has limited number sense how to count change or count money rather than teaching them how to use a credit card. So, socially significant and beneficial and may increase quality of life would be probably teaching them how to buy things with a credit card rather than focusing on basic number skills with counting coins. Um, because at this point, more functional to use credit card than to use change. Um, the next bullet point there is that everyone has the right to treatment in a competent, everyone has the right to treatment by a competent behavior analyst. So those who create behavioral treatments and who conduct interventions should have appropriate education experiences to do so. So we have a couple different accreditations that would monitor this. So one is the BACV, which is where all of us will become accredited if we are to continue on with our BCBA. But there's also state laws documenting and outlining what appropriate service providers look like as well. So the next one here is everyone also has a right to programs that teach functionality. So this really goes hand in hand with the previous one with the coin versus credit card example. So really just socially significant skills um, that will enhance the quality of life. Everyone has the right to behavioral assessments and ongoing evaluations. So conducting functional analysis, identifying antecedents and consequences for behavior in question, conducted through interviews, direct observation, creating treatment plans. So, really, this is signaling the need for ongoing assessment, so continuously analyzing data in order to make programmatic decisions. Um, Everyone also has the right to the most effective treatment available, so access to empirically validated treatments. So, really, just using our literature and our research to ensure that we are implementing evidence based interventions. So, that is the overview of effective treatment. Um, and really, it's just focusing on appropriate service providers, evidence based interventions, the need for analyzing data in order to make programmatic changes, and then really ensuring that we're focusing on socially significant behavior.